So as we were saying, Pam was talking about all these different aspects that we can get into our rehabilitation to help us in the acute stage and in the post-acute stage to assist us with brain injury to reintegrate back into our communities. And so today we are very, very blessed to have Collage Rehabilitation Partners to talk about how we can access these post-acute services no matter where you are in the state. So please join me, give a brain injury welcome to Jenna from Collage Rehabilitation Partners.
Yay. Hi, everyone. Thank you. Thank you for the warm welcome. I just wanted to start by saying thank you so much for having me in this safe space. I know that, it is a really, really nice place for all of you to get together to kind of share your stories and things you've been going through, and just to have, guest speakers and me in general is just an honor to allow me into this space. So I really appreciate it. What I'm going to share today is just a little bit about our program. All of you, it sounds like, are at different, stages of your recovery. Some, it may have been, it's just been a few months. A lot of you, it could have been a few years, but regardless, I feel like just talking about this program and talking about the importance of recovery in your home and community is just so important, because all of you are your best advocates for the care that you get now and just moving forward, and for future brain injury survivors as well. So our name is Collage Rehab Partners. We are a partnership between Remed and Learning Services. So Remed was an East Coast company, Learning Services West Coast, and now our name is Collage. Me, myself, I initially thought, oh, Collage, that's a very interesting but unique name. So what does it have to do with rehab? So I decided to look up what is the definition of a collage, right? Kind of putting things together on a piece of paper. And the definition I found was a collage is a technique of art creation by which art results from an assemblage of different forms, thus creating a new whole. So I thought that that was a really cool definition, just kind of explaining how our program, a post-acute rehab program that's focused on the person as a whole, and all of the professions coming together to help to rebuild and recreate this new life after brain injury. All right, perfect. Thanks, Daniel.
You just tell me to
switch to the next one. Sounds good. So what makes our program unique? Number one is our expertise. So we've been in this field for quite a long time, over 35 years of expertise in treatment of individuals with brain injuries. Like I had mentioned in the beginning, our programs were initially Learning Services and Remed, and both of those programs have been around for a lot of time. So a lot of our clinicians, our staff members have worked with, the brain injury community for a very, very long time and are super passionate about the care that we provide. Number two is our care is super individualized. So services are provided to meet the unique individual needs of the patient. Every person is extremely different. And with that being said, every person needs a different approach to the kind of care and services that they're going to get. Not everybody's going to want to be involved in a certain type of activity or sport or go back to school or work. So it's really important for us to look at the person and their unique contribution to the therapy process. Number three is just the functional outcomes that we are trying to go towards. So really making sure that we are, person client centered, making sure that the goals are, goals that all of you really, really want to work towards, not just the therapist goals, but the goals that all of us kind of create. Like, I want to return to, school. I want to return to being able to be successful with cooking. Everything is very functional. We are CARF accredited. What that stands for is the Commission on Accreditation of Rehab Facilities. So that means that we had to pass a lot of just different standards of care. We're involved in a lot of research, and that accreditation just shows that we are, very patient-centered and functional. We use functional outcomes as well. And then number 5, continuum of care. So our program is really, really centered on making sure that we provide care for a patient from the start of care all the way to the end. We have an inpatient residential program, which can lend itself into, providing supported living for somebody, day treatment, outpatient, and then finally a newer home and community program. So it's such an amazing experience for patients to be able to stick with us once they've, come from a really, really fragile state from the hospital and then through the recovery process, whether that's, a couple of months or a couple of years to come. Next slide. Thanks. So as Daniel showed before, where do we fit? So in this continuum of care, there's the acute phase and then that post-acute phase, which, is the most vital aspect of therapy. As you can see, there's the circled squares right here where it shows the post-acute residential transitional rehab. And then it can lend itself to either the supported living program in a group home or apartment. And then finally up at the top, the home with family with outpatient treatment or with home and community services. And next slide. So this is just kind of an overview of what our program offers. We are based in Southern California. And like I said, we have a post-acute inpatient program and then a program where we go to a patient's home and in their community. So on our Escondido campus, that's where our inpatient program is. We have the post-acute residential neuro rehab. Something we really, really value is just providing that, as close to one-to-one care as possible. So the ratio for staffing is 1 to 3, which is pretty good. We really, really try to stay patient-focused, individualized as much as we possibly can. We also have day treatment out of the Escondido campus and then supported living. And then in the client's home and community, that is our new home and community rehab program. And that is all around LA. As it's listed, it's Orange County, LA, Inland Empire, all the way down to San Diego. So really, we have clinicians spread out all over, your occupational therapist, speech therapist, physical therapist, social worker, neuropsychologist, the whole gamut of therapists that come to your home, really evaluate, your goals, your needs within the home, but then also your surrounding community. Next slide. So as I was explaining, for our home and community program, which is really my focus today, it's really, really interdisciplinary, which is so awesome. As you can see, the home and community patient is right in the middle there because truly the patient is the center of the care and they are the most important team member of all because you are the one that, we are working for to help you achieve your goals. There's also, as I had mentioned, physical therapy, neuropsychology, social work, rec therapists, and so on. So all of these team members have their own individualized goals with the patient, but then as a whole, there are group goals that we try and get back to. The most important part of this program is that it's functional, right? We really, really want to reach the goals that you want as the patient and as the center of this team. So in the stars surrounding the circle are just some examples of areas that we are working in or working towards, right? We might help you return to school in a modified capacity, go take a visit to the beach. How are you going to be able to get down to the water or be able to walk through the sand? Taking visits to the grocery store. How are we going to be able to achieve our goals? Maybe going to the grocery store at a time where it's a little less busy or using the cart for the physical supports. Returning to work in whatever capacity you might be able to or might need with the support that you need. Returning to the gym, right? So a lot of our therapists will go to the gym with their patients and maybe test out some of the equipment or try to help you with a certain rehab routine that's best for you. And then finally, my favorite, the coffee shop. So maybe going to the coffee shop, ordering a coffee. I think it's important to note that a lot of our patients have these really, really big goals, but sometimes it's scary to go out in the community and try these things on their own for the first time after an injury or illness. So I think it's great that, our patients are enlisting these therapists as really their guides and their friends in this journey towards recovery, and doing these things with them. They're really their advocates, and then they're helping the patient to, build up their courage to be their own advocates over time as well. Next slide. So what is home and community rehab? So this is just a little definition of what home and community rehab is. Home and community rehab is in the patient's home and community. So what we found through a lot of the research that we're involved in and just the patients that we've seen over time is this is the most environmentally valid location for patients and people to learn functional skills to provide the best preparation possible for increased independence. There's only so much you can do when you are doing simulated activities. And although those are really helpful, being in, somebody's own home, working in their own environment, and working on the goals that they have in their own community or their own park really lead to the best functional outcomes. It's also the most fun we found. I think a lot of the therapists and the patients that we work with really enjoy it the most because they get to do things that they've just have been wanting to do since they have had their injury, but it's scary or kind of unknown how those activities are going to go. So our therapists are really that support system and backbone to help people, go and try and achieve those goals. It also says patients receive 20 to 26 hours of treatment per week in their home. So unlike some other, home health or potentially outpatient programs, we provide a lot of therapy because it is quite intensive, but it's also necessary. Having that amount of therapy in the home and community, we have found really, really leads to the best outcomes. And then it also says length of stay depends on the payer source and progress, but can range anywhere from 6 weeks to 12 months. Next slide. Yeah, thank you. Okay, so this is a picture of one of our patients. It says, Mr. M is a 37-year-old with paraplegia who sustained his spinal cord injury after falling 30 feet from a ladder. Prior to his accident, he was an avid outdoorsman, and this picture was taken, of course, with permission by the recreational therapist as they were kayaking in Long Beach. So this is just an example of, the kinds of activities that some of our therapists are doing with our patient, which it's so meaningful. It was such an incredible experience for him, for the whole team, to really go out there, work on something that he has been wanting to do for so long. I actually had the advantage of talking to one of his speech therapists that worked with him because I wanted a little bit more background on who this patient was and kind of some of the stuff that they were working on. And the speech therapist that I spoke to, her name is Valentina, she was able to tell me a little bit about some of the things that they've been doing in the 4 months that he's been part of the program. They helped him get access to Long Beach Community College to start taking classes again because he wants to be a personal trainer. He has transportation to and from his gym twice a week, so he's able to go and work out. He was able to get access transportation so that he can use access services to get around his community. And he is, starting to become much more comfortable with seeing his friends, some of his extended family again, and even to start dating again. So as she had mentioned, she basically said he is the perfect example of incorporating every aspect of his life and really working on not only how he's going to do these things with a therapist, but how is he going to do these things on his own again. And within 4 months' time, back to school, back to activity, back to leisure skills. It really is incredible the type of work that they were able to do with him. Next slide. All right, so why does home and community work? As I had mentioned before, it's a real life setting, right? So it's in your own home, your own community environment. So it really prepares you for the best possible outcomes because you're working in what you're going to be around day in and day out. Skills application. So the skills that you might learn in acute care in the hospital or in an inpatient rehab, you're actually able to apply them. So all of the simulated activities, or even if you are going into a center a few times a week, actually being able to try that at home is a great skill set. And not only the physical skills, also the cognitive and emotional skills too, as some of you were touching upon earlier in this, taking a lot of those like emotional work classes and working on emotional regulation and ways to, help to control anger, all of that stuff, being able to utilize those skills in a real life setting, whether it's you're with a group of friends or you are with your family, that is, really a true accomplishment. The education that our therapists provide is just incredible. I know we have sent a couple of patients to this support group. So I think it's important for us to really, work as a team and as a community to be able to provide the support and care that somebody needs after a brain injury. So our team members really work with the family and with the patients from the very start to provide them with, whether it's education on the brain injury itself, education on community resources, education on classes that they could take, all of that. And then collaboration. It takes a village, as many of you probably have figured out. It takes a lot of people, a lot of hard work and determination to really, work on brain injury recovery. So everyone on the team is really working together for the best possible functional outcomes in recovery. And next slide. So our program's admission criteria is medical stability. You have to be 18 years or older, diagnosis, acquired or traumatic brain injury, spinal cord injury, complex orthopedic injury is a case-by-case basis. Demonstration that the individual will benefit from participation in this comprehensive rehab program. So that's definitely the most important, is we want you as a patient or person to really benefit from what the therapist and you are going to be working on, and then the funding approval. So this is just a little bit of information on the referral process. You can call this number and dial 1 or 2. 1 is for the residential and day treatment admissions, and 2 is for the home and community admissions. I will say that, obviously a lot of you have probably been through either a similar program, maybe you have not at all. But even if you are already enrolled in a program or have been a part of this program, I think it's just good to know that this type of programming is out there, whether or not a friend or somebody that comes along to this group that might need, community services, that this is something that's out there. And it's just such a wonderful thing that if they're able to, be a part of it, they could be a part of it. And next slide. So contact us if you would like. This is my contact information at the top. I'm the business development liaison in the LA area. Below me is my colleague, Renee. She's the program director in the Escondido inpatient clinic. And then below her is my colleague, Jackie Rangel, and she's the clinical director of the home and community program. And next slide. Perfect. So that leads us to questions. If you have any questions about the program, about anything related to what I just spoke about, please ask away. And I'm happy to answer questions in the chat, or if you want to turn your mic off and speak.